the symptoms of dementia can manifest in various ways, but working in the long-term care home was really what sparked my interest in dementia care, and really wanting to work within the health system to say, how do we support caregivers, care partners, and then how do we support the person living with dementia, and how do we help to educate our communities about how to plan for the future. At the young age of 23, when I graduated from my master's program at York University, upon completing my social work degree, that was the first job that I got, was in a long-term care home, and just seeing the number of individuals experiencing dementia, and then also the challenges for care partners to truly have a meaningful visit. A lot of my work in my career has been around home care and long-term care. So I've met a lot of different families of different race, class, wealth, and even when I've interviewed or just had conversations one-on-one with a lot of families, a huge factor is finances, right? And being able to, say, pay to age in place, or pay to go to retirement home, or pay to hire a live-in caregiver. And when you don't have access to finances, that opportunity to age in place is very limited. So I think the experience and based on what I've seen for Black communities is that limitation, right? So even if we could have one individual age in place, it's always my question is, how do we make it more accessible? How do we make that option, increase that accessibility to that? And oftentimes the limitation is the finances. So, the government does their best to provide the supports that they can based on our population trends, and based on the resources available. However, there's still that requirement that folks do help and assist themselves to age in place. So that may mean, purchasing your own diapers or incontinence products, hiring somebody to cook meals or clean, or to be present at home when, say, the children might be going to work, or someone to stay with them overnight just to make sure they're safe, they're not falling. But all of that costs money. And some of the challenges for the Black communities, especially in Canada, is, there's been limitation in employment, social capital, so being able to just upward mobility, so just get higher paying jobs, limitations to access to education, which we know those are key factors that would enable one in the long term to be able to save money, to pay for those things in the future, or to pay into benefits that would help them in the future, such as private insurance and that sort of thing. So those are the challenges and the inequities that I've seen that have impacted Black communities. And I think one of the big issues is access. The caregivers or care partners are not educated, they don't have access to the family physician, or not connected to resources in their community because of where they live. Then we do have racism, really anti-Black racism, that's occurring in that particular case, because then we need to do something differently within those communities to ensure that individuals in those marginalized areas have access to a family physician, have access to the right resources, so that they're equipped with the knowledge and they know how to get the right supports, or even if they don't know what to ask, at least they can call someone to identify what a concern may be and say, is this something I should be concerned about? Really think about the cultural implications. The Black community is not, a monolith, meaning they're not every individual, every community is the same. We're taught this as healthcare professionals, but I think sometimes we may, in the speed at which things move, we sometimes might forget, or we may think we understand something, but we fully don't have that understanding. So even for myself, of Jamaican background and descent, doesn't mean that all Jamaicans want the same experience or the same response. So I think the important thing is meeting people where they're at, right? And asking those questions as to what would they like? How would they like to be treated? What supports are they needed? So instead of coming in with our own agenda or goals or questions we may want, I think starting with open-ended questions as to how can we help you is a key place to start. This was given to me by a daughter of a gentleman that I was supporting while he was admitted in the hospital. There were challenges amongst the siblings in, what that end goal would look like upon transition from the hospital. And she was really, really struggling with how to best support her father, still considering the decisions of her siblings who wanted her to take a different approach. And I remember she went down to the gift shop and she came back and she gave me this, I call it a coin. It's been in my wallet for, I'd probably say 10 years. And each time I transfer wallets with change, I just keep moving it. But it reminds me of the critical work that we do as healthcare practitioners, professionals, clinicians, and the importance of just being present for care partners, because oftentimes those conversations might have been an hour, and it's not like we were planning his discharge. It was really just helping her come to terms with the decisions that she's making, validating her thoughts, her feelings, providing suggestions of how she can work with her siblings, and commending her for the work that she did, because she was really, really struggling. So I carry this around with me as that reminder to say, you know what, keep doing the work that you're doing. And I think the key thing is, again, meeting with people where they're at and being that listening ear at all times. And the other piece, when I put on my doctoral hat and the research hat and kind of what made me pursue a doctorate is, the voice of Black communities has often been missing from the research. So I saw this as a beautiful opportunity to engage with my community, help to lift the voice and contribute to the research that is limited, especially within the Canadian context. But if I could have one wish before I die on this earth, it would be really to see that ability to age in place for marginalized, vulnerable groups who might not have access to finance, who are experiencing dementia, to be able to do that as well.